Good morning, everyone. Just waiting for a portable mic. I kind of like to dance on the stage. So how many of you are young enough to have seen the movie Back to the Future? Quite young people over here. So a couple of years ago, I presented Back to the Future 4 in Dubai, and that was just before the pandemic. And today I'm going to speak about Back to the Future 5, taking you on a journey. Can you hear me here? Okay, perfect. So let's imagine this is a time machine, and we're going to enter this time machine right now and see where it's going to take us. We're going to go all the way to the dawn of AI. That was a long time ago. We might think it's happening now, but it was a long time ago. 1967, the first ATM machine. People at the time were concerned that this ATM machine is going to take everybody's job. They were worried that if there is a machine that they can take the money from, people that work in the bank are going to lose their jobs. But did this really happen? It kind of eased the process. It made it easier for people. And those who were giving money at the time are now financial advisors and new roles within the bank industry. So basically back then, people feared what they didn't understand. Has that changed since then? Do we still fear what we don't understand? I think we still do, right? Okay, let's move on to the era of machine learning. The time when we thought robots would take over. The time when we thought it was the great equalizer. We had internet. Everybody had access to that internet. We search on the bar. We may or may not get the same results, but we have the access to it. We had algorithms that we thought are efficient to make things move forward and quicker, but it lacked that happiness. So for example, going into a shopping mart and getting your shopping done digitally, you may lose that human interaction with people around you. And there was no potential of creating that value when it comes to humans' behavior. But back then, we did understand what questions to ask. We realized that input is very important. What we insert into the search bar would result with what kind of answers we're expecting. Has that changed? It hasn't. We still think input is very important, even within AI. We'll move a little bit forward, actually way forward. I'm going to go all the way to the dawn of AI disruption. Generative AI. Do you remember this time in the pandemic? Those masks that we wear? I hated those days, but there were lessons learned. What did we learn then? We learned that there is a huge shortage in manpower when it comes to healthcare workers. In fact, we're looking into 10 million of healthcare professionals by 2030. That's quite low. We also realized that prevention is key because the burden of diseases when it comes to chronic illnesses is extremely high and costly to the healthcare system. We also realized that predicting is effective when it comes to having intelligence in terms of AI. What can we predict? What can we do to increase longevity, but healthy longevity? I want to live longer, but I want to be healthy when I'm living longer. So what can AI do in healthcare? I know I have the answers here, but anyone would like to explain a bit more? What did AI do for us so far? To me, I feel like AI is the co-pilot, an assistant where it can summarize my data, whether it's structured data or unstructured data. Structured as in, for example, our labs are predictable, our tests in the labs. Unstructured, like my notes as a doctor, can able to summarize those to us. It can boost productivity in terms of healthcare journey, digitalizing the whole journey, not just summarizing my notes, but giving me those alert systems so that I am able to remember and cover what the patient needs and don't miss anything. So it's like a tutor to me. It enhanced patient engagement in terms of education, not just patients, but healthcare providers. We have that continuous access to education and information. And not only it's available, but it's made simplified that I could understand it, you could understand it, anyone can understand it, and it's available in different languages as well. It can support in disease management. We've seen it in monitoring of self-monitoring patient care. We're moving down the line from someone who is getting into a curative care and getting diagnosis down to preventive care, and now even down to self-care and managing your own illnesses, owning your own data, if I may say. But there's always a question of what if? What if the information that AI is giving me is not correct? What if it's not accurate? What if there is a breach to privacy? What if the data that you're giving me is biased? What if there were disparities in the information? What if it changes based on my behavior versus your behavior? How can I ensure that the data that I'm receiving has quality? Does this question run in everyone's minds when it comes to AI? Do we trust AI 100%? Do we take everything that AI tells us for granted? I've seen so many people, not just in this conference, everywhere, when I ask a question, let me check, and we Google. In fact, yesterday evening, we did that exercise and asked AI a question, and we trusted AI. I'm not going to mention who, but they didn't trust what I said, but they trusted AI. So it's all about trust when it comes to acquiring AI. I want to trust it. Can I trust for it to be used, especially within healthcare, an area that is very sensitive, an area that may compromise my safety, an area that may compromise my privacy? So, in fact, there are quite few laws out there that looks into AI. One of them that was updated recently is the EU AI Act. There's the Canadian Impact Assessment Act and AI Bill of Rights. Three of these acts talk about the ethics of AI, accountability, transparency of AI. The UAE has an AI strategy. A lot of countries have AI strategies, but are these being implemented as a mandatory requirement? Are people aware that these fall under the umbrella of AI? And if I look at the list that UAE has, it does have the 4 principles of AI, but also adds other principles that are very interesting, like sustainability. Now, I never thought when it comes to AI, sustainability is a key, and it is. But we also look into areas like human-centered. Whenever I get an AI tool, my first question is, where is the human? Because if things go wrong, are we blaming the machine? Are we blaming the AI? Are we saying, yes, it's AI's fault? We can't do that. So these are the 4 principles of AI ethics: transparency, accountability, privacy, and algorithm bias. So when it comes to transparency, what comes to your mind? I would like to hear some interactions here. Imagine going from point A to point B, from A to B. Okay. I want to know, how do I get from A to B? I want to make sure that I'm able to explain it to you clearly, that you understand. I want to be able to trace it backwards and get the exact same results. AI has to be very predictable in getting the results from A to B. And I can interpret how it did it. If I'm able to say, yes, from A to B happens so and so and so, and I can explain it to you clearly, and I'm able to trace it and predict what could happen, then I'm saying that this system is transparent. And this system may be vulnerable but these are the vulnerabilities because I'm able to explain how it happened and trace it as well. Accountability. This talks about governance, clarity in the responsibilities. What is my role in this platform? What is your role? Is it defined? Is there a human in the loop that is held accountable? Are we aware of how it works and if things go wrong? And to what extent do we have accessibility? You need accessibility in order to have accountability, right? But to what extent without breaching the privacy of the system? Privacy is again about security. We spoke about that yesterday, and I think there are a few more presentations today, but it has to be consistency. To what extent there is a human oversight that is involved? What are the risks of exposure? And there are different kinds of exposure risk. It can be accidental exposure, or it can be maleficence. I purposely sold the data. And is the end user aware of the process? Is he aware that there is an AI component and that part of his data is exposed to AI or a human? Algorithm bias is how representative the data is. Is there fairness? Does it present gender disparities, female, male? Any other areas, for example, people of determination that represent them as well? Is there some accepted biases in certain scenarios that we're aware of it? And does it monitor our behavior? We had a conversation, it was on the dinner table the first night with an emoji that everybody looked at it in a different way. It was the emoji that does this. And in certain culture, it means thank you. Other cultures, it means, what's it? High five? Yes. So does AI is able to predict this and make it reliable or relevant to the culture that it's actually addressing? Okay, so moving forward, lessons learned from AI so far. We still know that we fear what we don't understand. We know that putting in an input is very important and it has to be very clear because it's one of the fundamental elements of ethics. Putting in the right question, you'd get the right answer. We also learned that partnership is very important. Having in governance involvement, public and private sector, patients involvement, that's all very important. We adopt trust through transparency and ethical implementations. Is this where I start dancing? Okay, we'll have more equitable access to patient-centered behavior and measuring this ongoing biases. So we keep testing and testing and testing to mitigate those possible risks. And how flexible and agile the system is to adapt for us in the future and scale that further. Future. Now here I need your involvement. What do you think the future is like? Anyone? Bright? That's a good one. A little bit more descriptive. Back then, when let's go back to the ATM description machine at that time in 1960s. Did we imagine what we have right now? We had no idea. What do we think based on what we know right now? What do you think the future is like? This is how I think the future looks like. I am not sure if the future is there or not. It's clear, foggy. I can see some mountains at the back, but I don't see how big they are or to what extent they lead. Why? Because all our presumptions are based on biases. Biases of future that we prefer or what we expect it to be ultimatum, like the best future, or what could be the likely future. There are a lot of things that we know, we don't know. There are a lot of things that we don't know that we don't know as well. And this is all based on our values as humans. How would that change the perspectives? Because AI, one size does not fit all. This keeps changing all the time. And this uncertainty creates that biases. That's why we need as many perspectives as possible. My perspective, the UAE health regulations, your perspectives from your countries and your backgrounds, your perspectives as expertise in certain areas would all have some idea of what possibly the future would look like. Thank you.